Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. If you are new or regular viewers that had not had chance to subscribe yet, please make sure you do subscribe. This way you not only you help me and you help support me, but you also help so many other people find this valuable content that's completely free and very informative, educational, and supportive. And oh my goodness, do we need that content more than ever today? If you don't yet follow me on Instagram, especially if you are trans femme identified, trust me, you want to follow me on Instagram. And if you follow me, you already know why. I put a lot of amazing, supportive, empowering content for trans women on Instagram. So follow me below. Links are in description box. And welcome to our Fridays Q&As. As always, if you don't know what they are, this is the place where I get to answer your direct and specific questions. So if you have questions for me or questions, email. My email is in description box below. All you gotta do is email your question, keep it relatively short to a very small, no more 3 to 4 sentences paragraph. And I will include it in Q&A. I put all questions in a folder and then I randomly select 5 and make sure I always go through entire folders. So if yours doesn't get answered today, it will get answered in the next Friday Q&A. Rest assured. So if you want to participate, feel free to go ahead and email me your questions. There is no such thing as overly complicated question. I take on challenge of everything, and I'm really excited by the challenge, by the way. So for today's Q&A, as always, there's timestamps below on topics covered, as well as I blocked out everybody's individuals, names, emails, all of that information that can be identifiable to you. English, hello. And let's get started. Very, very excited. First question for today. I'm 21 years old, was assigned female at birth, and have known I'm gender fluid, specifically gender fair. I never know how to pronounce it, for 6 years. So gender fair is, my understanding is that it's almost like an extension branch of a gender fluid identity where individuals identify as variety of fluid identities, including masculine identity, but not exclusively as a binary male presentation or identity. The biggest conflict I ever had is that I can't prove that my experience of gender is real to other people. And I have had serious problems accepting that I am, in fact, gender fluid. What is your advice specifically for gender fluid people to deal with the stigma against gender fluid people that our genders are real, and embrace all sides of our gender identities the best we can instead of giving into the pressure? This is a really good question, and it's a very, very relevant question for today and what's going on in today's world. I'm going to start answering this question by saying that, without a doubt, in my experience, gender fluid identities, non-binary identities, identities that fall outside the scope of closer to the binary end of spectrums, are the identities that people struggle with the most in terms of trying to experience visibility, trying to experience being seen, being acknowledged, being included. For binary identities, it is a matter, unfortunately, in today's society, it is a matter of reaching particular gender marker qualifiers. And I say unfortunately because passing is not everybody's goal, and it shouldn't be everybody's goal, and it should be emphasis. Emphasis should be on overall well-being. But for binary, toward more binary end of trans man, trans woman, once people kind of get closer to those gender qualifiers, then they are experiencing that acknowledgement from the external world, and that can feel very validating. For individuals who are, like I said, non-binary or gender fluid, scope of identities, including gender fair identity, it can be much more difficult because there is no gender qualifiers, and the world is still looking at you, expecting to cluster you in their headspace in the male or female category. So for that reason, it's first and foremost, already puts you, unfortunately, on this much more ongoing, challenging ground. To counter that, I gotta say is that fortunately, a lot of parts of the world are changing. Younger generation is being much more aware, much more knowledgeable about gender and gender identities. I'm seeing so many more content creators. For example, you all know how much I love tarot cards and tarot for psychological self-growth. And I watch tarot YouTubers who are, as far as I know, identify as cis. And when they talk about a particular tarot creator, I notice they use language they when they don't know what their gender is. So I'm noticing more and more individuals are becoming more mindful not to speculate or assume what gender is and use more gender inclusive, much more neutral pronouns. So fortunately, that is happening. For this generation, including yourself, it may just not happen fast enough. The good thing for you, you're only 21 years old. You're very young, which lends me to believe you probably have friends who are in your age group. And chances are, if you have friends in your age group, they should be ideally much more supportive, open, and inclusive because, like I just said, they grew up in a world where we are fortunately finally expanding our understanding and concepts of gender. Having said that, what is advice can I specifically give you how to deal with stigma against gender fluid people? Specifically, your question that your gender is not real, and how to embrace all sides of you. Well, I gotta give it to you. The best way to deal with all of it is honestly just to recognize that you have to create a kind of like a barrier between yourself and other people. And you have to acknowledge that people, one, not going to understand, some people aren't going to understand, and two, there's people going to be who also don't understand, and on top of that, stigmatize you. On top of that, mock you. On top of that, tell you that your gender is not real, that it doesn't exist. And you just have to find a way to allow it to roll off of you back. There is going to be absolutely no use and no point fighting it or trying to prove them anything. There is definitely not going to be any point in trying to educate them. In my experience, especially people who go out of their way to say something hurtful, to say something negative, to say something mean, their intention is already set to put you down, to have power over dynamics so that they can feel good and empowered about themselves, because internally they're operating from a place of smallness. Okay? Nobody who feels good about themselves, even if they disagree or don't understand or don't even maybe respect what they see, will go out of the way to put that person down, to hurt them, because that's a power over moves that they don't need to engage in. So recognize that and just withdraw your energy. Put all of that energy into focusing on yourself, focusing on rooting your ownership of your identity strongly by holding on to your narrative, holding on to your experiences that makes you feel connected to yourself. And connect and spend more time and energy with people who see you, who support you, who validate you. That is my biggest advice. But you are going to continue to experience everything you just stated in that question. That is just, unfortunately, no way around it. This is just a byproduct of being a gender fluid person in today's world. And that sucks. And the more you're going to be stuck asking yourself, why me? Ask yourself, why not you? Okay? We're all living in a particular time frame for a particular reason, right? And every century there's some kind of group cluster of people that is going through a period of really what you're going through right now. And so sitting back and just wallowing in. I know you're not, but I'm just saying, additional little tip. Focus on now and focus on how you can embrace yourself versus tear yourself down. But yeah, just don't pay attention to those people. I know it's really, really hard, but only you know how you feel about your gender. Really good question, and I wish you all of the best. Question number 2. Can there be different personalities when presenting different genders? For example, if someone is born presenting male or female, can they feel like a different person when they transition? Can they refer to themselves with 2 different names as if they were 2 different people? This is a good, albeit more complex, nuanced question that does needs a little bit more context, but I'm going to do my best to give you an answer. So, when I hear can there be 2 different personalities when presenting different genders, and especially can they refer to themselves with 2 different names as if they were 2 different people? To me, that sounds more like potentially dissociative identity disorder. Now, lots missing in the context, this does not mean that you're experiencing dissociative identity disorder if this is your experience. But this means that, at least it reads to me immediately as splitting. Psychologically, splitting occurs when an individual concept of self starts to split and create clusters of identity, right? That's what essentially dissociative identity disorder is, which often happens as a byproduct of a very severe trauma, where trauma happens to a person and their self is unable to contain the pain and the experience of trauma, and as a result, the self splits to create an alter identity that then can cope or maybe can at least go through trauma. And then sometimes you split even more into various identities, and each identity has a purpose, has an inner sense of, this identity tends to protect me during the times of re-experiencing of trauma. This is identities that I feel the most empowered in. When people work with dissociative identity disorders, the goal is to integrate those clusters into, again, a whole identity. So that's what it sounds to me like, splitting. Now, there is a difference between people who are, let me try to explain it. So there's the clinical, that's not a right word. There is an actual phenomenon of psychological splitting, which leads to dissociative identity disorder, which then the person will, depending on different context, will almost appear to be as a different personality. And a lot of times they will not be even conscious that they have shifted personalities. And then there is tendency in all of us, to perceive ourselves internally as multitude of personalities, right? Which is very different from splitting. And within all of us, there's the core identity. Like with me, there's the core identity that I see myself, right? And then there's sometimes, depending how I present myself, you all seen the video where I did my vampy makeup. So when I do my vampy makeup and I don't wear red lipstick, I feel like a different type of Natalia. Still the same, but slightly different. Maybe when I engage in my hobbies and passions, I also a little bit different. When I'm around my family, maybe I shift a little bit and also different. We usually call those parts of ourselves as personas, taking on different characteristics, but yet they're all come back to this cohesive, unified self. For some individuals who are starting transition and they're early in transition, it is very common to have this kind of polarity going on, where to some group of people, there's their authentic self and they go by their preferred name, and to other group of people, there's their old selves and they're still go by their old name. That's very, very common. And in a lot of times, that's kind of natural for people to do as they evolve and as they progress in their transition. Especially for those individuals who have children, young children, it could be that your kids are still calling you, for example, for individuals who are assigned male at birth but transitioning, your kids might still call you daddy. Then you may shift to a nickname where they call you maybe Mimi, right? So that's kind of natural to have that happen. And that happens quite a lot. And that happens to a lot of you who are watching, where when you started off, you were presenting yourself to the close supportive group, but weren't yet presenting at work. And so as a result, a lot of you have done kind of this tendency to split, but without really splitting your psychological cohesive self. So is this possible? Yes, it's possible, but it's contextual. It's possible within that context of early in transition as part of the process. When people do this for a long time, meaning they're still occupying two genders, they're still in their old self and their new self, and I've done videos about it too, I never recommend doing this for a long time, because the analogy I always make, you have one foot in your old self identity and new foot in your new identity, and the longer you do it, the longer your legs stretch, and eventually something is going to have to give. So the goal is to move more forward to your authentic self. Unless you are gender fluid and you're constantly occupying different dimensions of gender, that would be a different story. But this would be my answer. So there is a clinical component as an dissociative identity, and that's where people split. And then there's non-clinical component where we all have this different personas of us that are part of unified self. And on top of that, early in transition, it is very common for people to be kind of dance between the old self and the new self. But this is a good question. Complex again, some context is absent, but hopefully that gave you a little bit of clarity. Question number 3. I've just passed 5 months on 4 milligrams estradiol, and I'm just starting to notice some changes in breast growth. It has made me a bit less confident moving forward. Would you suggest or talk about anything you know about relaxifying or any terms aiding in transition? So relaxifying, my understanding, and again, please keep in mind, not a medical doctor, PhD, the clinical doctors in clinical psychology, but nonetheless, I versed in majority of this medication because you have to understand a lot of my clients are taking them. So relaxifying, in my experience and my understanding, and there's another one, starts with I think it's anastazone. There's like another one. These are the medication that block effects of estrogen on breast growth. So let me just finish. The question is, how would you go about assessing that as assigned male at birth? So relaxifying and the other one, anastazone, are medications that I have seen people take when they are assigned male at birth and they want to step in the hormones in order to help decrease gender dysphoria. Maybe they want to microdose in order to alleviate gender dysphoria, but they don't yet either want to socially transition or have no plans to go through any kind of transition period in their life. They just want the hormones to help ease the pain of dysphoria. And because they don't want to transition at all, a lot of times, at least in my experience, they don't want the physical breast changes because they understand that if they get the breast changes, that's going to potentially raise eyebrows in their social environment, in their private lives, at work. And so as a result, they consider this medication that prevents breast growth while you're also on estrogen. My understanding also, and again, check with your medical providers. Everybody, please always talk to medical providers about medications. My understanding is that these medications, while blocking blocking breast growth due to estrogen, also then basically they operate in a way where down the line, when you do decide to perhaps transition, you change your mind or things in your life change, and you go off this medication, it's very difficult to then grow naturally breasts. There's something about it that it's like either completely blocks receptors and I don't know exactly to what extent. So that's something to keep in mind first and foremost. And again, something to always talk to medical providers. With any medication, hormones, and anything else out there, you always want to outweigh pros and cons. So the question is, you're 5 months on estrogen, you're starting to develop breasts. And it's making you less confident moving forward. Would I suggest you taking this medication as part of supporting your transition? I'm assuming, since you're mentioning aiding in transition, is that you actually do want to go through transition. But it's just that the breast growth happening is maybe faster than you're ready to come out yet. And so it's making you anxious, right? So you want to like pull back and slow down. If your goal is transition and you want the benefits of breast growth down the line, then relaxify and anastrozole might not be the best options for you. Talk to your medical provider, confirms that yes, it does will affect your breast developments later. Find all of that out. What I usually suggest for people in this scenario where they started estrogen and they get breast development and it making them less confident to move forward because they're not ready to deal with physical changes yet. It's almost like physical happens before social or psychological things happen before you even caught up to where you're at. I have 2 suggestions. My first suggestion is a lot of times in the beginning, and you're only 5 months in, it could be that there is, and I made a video about it called rapid breast growth and hormones, when it appears like you're having a very quick breast growth, but initially what happens is your breasts are budding. And when they're budding out, it feels like, first of all, they're very sensitive. And on top of that, nipples budding out, it feels like things are happening really fast. But in my experience, it's almost always follows with a plateau where it's just little breast budding and that's it, it stops. So could that be the case? 1. 2, if that's not the case and you're still very uncomfortable and it seems like your breasts continue to grow, then during this period, I would, if I were working with you, I would assess how ready or how close you are to socially consider coming out and socially starting to own who you are. 5 months on hormones is about that. It's like the nice sweet spot where I would probably nudge you if I were working with you, depending, of course, on your circumstances. If you're absolutely not ready and it's really making you less confident moving forward, can you consider wearing a binder for a short period of time or a more baggier clothing so that you can feel more comfortable when you're out and about? Those are my suggestions. I would consider medication in your case if your goal was not overall physical transition down the road. Again, if your goal is, I just want to take hormones to cope with dysphoria, and I don't want any of those physical changes, and I don't want any of those other things that come along with it, then that definitely discussion I would recommend for you to have with your doctor. But if that's not your goal and you do want to develop breasts and you think you're going to transition in maybe 3 months from today, I think medication might actually not be a best option. So hopefully that answers. Think it through, explore it, talk to your medical provider. But very good question. I love these questions. I miss Q&A so much. I'm thinking, why did I ever stop doing Q&A? I know why I stopped doing it. It was a lot to edit it and to film. They oftentimes can run longer than my other videos. And as much as I love you all so much and enjoy, nothing gives me more pleasure than to share information with all of you and to create content. It's also on top of individual client work and a lot of other work that I do. I notice it really depletes my energies a lot. So I'm trying to balance it, but I miss it so much. Trying to be much better at balancing everything in my life. Question number 4. Hi, Dr. Z. Thank you for Q&A. You are very, very welcome. My question is, I struggle between either identifying whether I am non-binary or just gender fluid. How can I spot the difference? Ooh, very, very good question. Gender fluid and non-binary identities are oftentimes can be clustered together. They oftentimes can be, people can see them as overlapping, and oftentimes I hear people will describe themselves is the way I understand a gender fluid identity, but they would describe themselves in fact as non-binary and vice versa. So in my experience, what I found is that identities that are not binary, right, and even binary identities in today's day and age are really, it depends on how a person really sees them, is what I'm trying to say. I found out is that everybody has their own way of understanding and conceptualizing and relating to identities. So having said that, I'm going to share with you my understanding over the years of gender fluid versus non-binary identity and see if what I say and the way I see it resonates with you. If this is not how you see it and understand it, consider that that's also valid. Please remember, all of us are dancing around and orbiting around language that we're still trying to grasp it and trying to aim it to describe things that may be very difficult to really pin down. And so there's a lot of people who experience their gender identity completely outside all of these labels that we have today, that makes it very difficult for people to kind of figure out who they are. And as much as a lot of us don't want labels, don't like labels, language as a form of label is also incredibly important, because if we can find something that helps us identify who we are, well, the definition helps us to feel anchored to some sense of selfhood. So it's also equally important. So I'm going to share with you my understanding of gender fluid versus non-binary. So when it comes to non-binary identities, this is what I often see people say: oh, I'm comfortable between going back and forth being a man and a woman. And my understanding is that that's not how I understood, and working with a lot of non-binary folks, that's not what I'm gathering is their understanding either. Oftentimes, the understanding of non-binary identity is, and this is the key word, not exclusively male or female. The non-exclusive capacity, which means basically not exclusively either a man or not exclusively a woman, is the cornerstone in my understanding of non-binary. Meaning that these are individuals whose identities could be oscillating or not even oscillating, but could be a composition clusters of multitude components of masculinity and femininity, but not exclusively one or the other. So maybe there's days when it's a little bit more than the other, but there aren't necessarily days for non-binary folks, in my experience, where they exclusively, oh, today I feel like a guy, tomorrow I feel like a girl, right? And again, non-exclusive is a cornerstone. And oftentimes, people who identify as non-binary are also going to have a lot of times will have a very strong non-binary presentation where you will see that the non-exclusivity is absent in a sense of you are looking at a person who has presentation that is masculine and presentation that feminine, and it's all married together where you have no idea whether, if you were to assume their binary gender, you wouldn't know what it is. And that's the cornerstone, is that non-exclusively one or another. Gender fluid, on the other hand, are individuals who have natural fluidity, natural capacity to move throughout gender spectrum. So if a gender spectrum is like luminescence, these are individuals that can comfortably dance around and shift around and stop anywhere on gender spectrum. They can feel exclusively as one gender and can't feel exclusively as the other. They can definitely sometimes feel like very masculine and sometimes as very feminine and sometimes as neither. And for them, it tends to be naturally kind of shift from one to another. So that is my understanding, and hopefully that helps you clarify. If this resonates with you, then great. On my website, under blog posts, and I have blog posts broken down into trans-femme, trans-masc, and non-binary blogs. In non-binary section, I think I have 2 blog posts that talk specifically about gender fluid, also genderqueer, and non-binary identities and what they all mean and how to really. There's also questions, a really good article in there that I've wrote about questions to ask yourself to figure out if you are non-binary. So hopefully this helps. Check out the website. It's going to give you additional information. And finally, question number 5 for today. I came out to my partner as trans, and she's very unsupportive and said I can express myself in the privacy of our home, but nothing beyond that. She's also very against the transition and said the marriage will be over. We have been together for 18 years. What do I do? First of all, my heart goes out to you. My heart goes out to everybody who is in a relationship and experience what sounds like an ultimatum. Ultimatum to me is when a partner tells a disclosing partner that they absolutely can't do A, B, or C, or they're going to end the marriage, right? Ultimatums by nature don't have any room for negotiations. They're not meant to be open to negotiations. They're meant to be either my way or highway type of thing. So what do I do? You've been married for 18 years. That's a very, very personal thing to figure out. I'm going to be next month, I will be 19 years together with my fossil. I call my husband fossil because we have 17 years. We're 17 years apart. We have 17-year age difference. So I call him fossil. He's my wonderful fossil. And I wouldn't even, this is hard, right? When we spend a long time with our partners, if there's also a good traction in a relationship, it's very difficult to figure out what to do because there's so much investment. You have invested so much in this relationship. And as humans, we're so risk averse. And even without being risk averse, there's so much fear to let go of everything that you have built with this person. There's also, on top of that, is tremendous fear for trans people that if you were to leave this relationship, you will never find another one. So on top of just walking away from what you see as a long investment, interpersonal investment, there's also this big fear that you're going to lose, that you're never going to find love again. So a lot of fears are going to be oscillating in your headspace. What I found in my private practice, working with so many couples, is that I have never seen an ultimatum work. oftentimes what happens is that ultimatum gets issued. And a person who is struggling with gender dysphoria is going to try to adjust and adapt to ultimatum. And the way you're going to try to adjust and adapt to ultimatum is that you're going to try to justify your partner's ultimatum. You're going to try to rationalize their ultimatum. You're going to try to also convince yourself that it's fair, that of course, how can I, it's so selfish for me to demand, to ask my partner, it's so selfish for me to think about transition. We've been together 18 years and my partner is the married, my assigned gender, and it's so selfish for me to think about myself right now. This is how you're going to try to justify and rationalize it so that you continue to stay in position and not feel resentfulness or anger or contempt. But no matter how long you try to rationalize, the pain of dysphoria and the pain of holding yourself back almost always ends up in resentment regardless. And in the end, I still see people that make decision to step toward into their life, and as a result, relationships do dissolve. I also see individuals who continue to stay in these marriages, and I worked with those individuals, and they continue to struggle with it. And my important thing when I work with those individuals is that, okay, so let's accept that you made a decision to stay and put your well-being behind and not to take care of yourself. That's fine. But let's just make sure you're not actively blaming and not taking any accountability and blaming your partner for not letting you transition. Because even though your partner did issue an ultimatum and there's no room for negotiations, by issuing an ultimatum, your partner is also telling you what their limit is. And that's also valid. It may not sound fair, but it's valid. And you still have a choice, even though it's a choice you don't want to engage in, but you do have a choice to take care of yourself, to choose yourself, to take care of your health. So I'm very, I'm one of those like tender, loving, strong bear mamas who I will definitely tell my clients, no, we're not going to blame your partner. Your partner just told you what their limit is. If you're staying in a relationship and it's causing you pain, then you're not addressing your own limits. Let's talk about that. So that's something to think about. I also encourage you, and I encourage all of my partners to think about this. If you are in a relationship and your partner is hearing your pain, hearing your struggle, and is saying no, something to think about, isn't it? Because essentially your partner is not acknowledging your pain point. And I really encourage for you to think about, do you want to continue to be with a partner that disregards your suffering? Again, that's something to consider. But what exactly should you do? I don't know. I've seen people who stayed. I've seen people who left. I've seen people who stayed and waited until they just can't stay anymore. All sorts of things. This is very personal. It is very complicated. When we've been together with partners for that long, to untangle ourselves is not that easy. There's a lot of emotional entanglement. There's a lot of attachment. There's a lot of codependency for a lot of people. So my advice is, don't beat yourself up. Dive deeper into all of this. Think about what matters to you. Think about yourself too. Consider all of those things. And see if you can come to some kind of place of decision making. But I know this is not easy. This is not easy. So very, very tough for all of you. So my heart goes to all of you who are in this situation. Great questions. Oh, I think I'm going to need a little bit of a lemon tea for my throat, but this is phenomenal questions. As always, if you would like to participate, email me a question or questions, and I will include them in Q&A. I Love engaging in Q&A. All of these questions are wonderful. If you have feedback for any of these individuals or support, comment below, share your input. This is a space of community. This is a space where people are sharing information. So comment below, like this video, subscribe to this video. I would also very much appreciate that. And I will all see you next time. Goodbye.